good afternoon. This is Physio Krina from HealthQ Rehab. I work under the neuro rehab team expert, and today I am going to present about how to treat your vertigo. So, as we know that we are running a vertigo awareness camp from last week till the 30th of April, there was a request from the patient's end that please upload like how to treat your vertigo as and let us explain to those things as well. So we have decided to come up with this online webinar so that the patients and the therapist who works under the vestibular rehabilitation can have advantage to work and check along with us that how the HealthQ rehab is working on the vestibular rehabilitation. So I'll share my screen and we'll start with the webinar. Yes, so this is the starting of how to treat your vertigo. So basically, what is vertigo? So vertigo is a feeling which is suffered by a patient itself, spinning feeling, floating feeling, rotatory feeling, or the surrounding which is rotating in their head. So we'll come up with a new poll like who are all the person who is watching this webinar. So I guess there are a lot of people who get advantage from this webinar. It could be healthcare professions, it could be the patient themselves, and it could be the healthcare students as well. So whoever wants to take an advantage from the vestibular rehabilitation can overview this presentation. As we understand what is vertigo, so vertigo is a feeling of unsteadiness, lightheadedness, wooziness, sensation of moving, spinning, is a tilting and a floating sensation. And where this sensation is coming from basically, and who are suffering from this. So why this vertigo comes up? So vertigo is not a disease, not a condition, and not a syndrome. It is a mechanical imbalance, mechanical problem between your eye, head, and brain. So the sensations which is inputted, which are getting input from the visual feedback, is making imbalance and the faulty sensations going to our head and brain, which is processed faultily, which creates an vertigo. Who are suffering from this? So approximately 9 million people out of 1.3 billion population in India are presently suffering from this vertigo condition. Vertigo can be either because of several reasons. It could be because of central causes and peripheral causes. Like what are the vertigo? Basically, it's defined as. So vertigo is basically divided into two types. The one where the vertigo is felt by a person, where the feeling is the person is stable, but their surrounding is moving. And the other type of vertigo where the person feels the person is moving with the respective to the surroundings which is stable. So the true vertigo, what is the person who is itself moving with a stable environment is the true vertigo. Where this vertigo is basically coming from? So vertigo is basically coming from the vestibular system, and where the vestibular system is divided into. So the vestibular system is itself origins from the inner ear. This is the inner ear, what we can see, where the vestibular apparatus is present. The inner ear is supplied by the vestibular nerve and gives several of the outputs to the smaller brain and the larger brain, which is known as cerebellum and cerebellar cortex. So the vestibular system is responsible for the vertigo, and the pathways through which the vestibular system is connected with also gives a symptom of vertigo. So the vertigo is coming from basically four categories of the anatomical structures. They are inner ear, a pathway between ear to brain, inclusive of the neurons and the nerves, from the brain or due to the brain tumors, because of the heart problem, because of the low blood pressure, which is known as orthostatic hypotension due to the immediate postural change, and the neck dysfunction. As we know that the neck is comprised of the cervical spine, which has also constituting cervical vertebral base artery, which is responsible for supplying to the brain stem as in awareness and the reticular system. So this artery, when gets blocked or when gets impaired or impinged, creates an vertigo. So I would like to know that what is the basic system of the vestibular system is functioning all about. So there are four options here. As we understood the functions of the inner ear, what does the inner ear basically functions from? Does it involving only hearing? Does it only involve in balancing? Both of above and none of above. I guess most of the answers for this of the functioning of inner ear is both. The inner ear is responsible for hearing as well as balancing. Hearing of the different decibels of sound and balancing in the different situations on the uneven surface, even surface, in a response to flight and fright, and in a response to calming. As we understood the structures which is responsible for the vestibular system, we have divided the structures into four portions. Basically, the system of the vestibular apparatus, which is semicircular canal and ventricle, the neuronal pathways, and the supplying structures of the cerebellum and the larger brain, which is the auditory cortex. So here, as in the figure, we can see that there are, which is known as semicircular canals, which is responsible to detect an angular motion. This semicircular canal ends up into the vestibular apparatus, which is known as utricle and saccule. This is responsible for the linear motion. So the motion which is up, down, and rotation are detected by the vestibular system, which is present in inner ear. The yellow structure in the figure is suggestive of the nerve. This nerve and the neural pathways gets into the brainstem, reticular system, and thalamus, which controls and coordinates eye and hand. This eye and hand motion is which controls the balance and different muscles of the body, which is responsible to maintain our balance in terms of different sounds and surfaces. As we understood, the three semicircular canals has the neuronal pathways uprising to the brain. Here, the basic functioning and the control of the balance and the control of the body happens. There are several other mechanisms according to the hypothesis where the person is responsible for all the types of control and the responses, out of which there are several mechanisms known as the vestibular sympathetic tone, peripheral vestibular tone, push and pull method. All these reflexes and the basic hypothesis gives a theory to the vestibular system and balancing. Let's understand how this works. So what is the vestibular system is all about? Vestibular system is basically in the background, which is acting as the behind the scene process. So when the vestibular system is deactivated, we suffer from lot of problems in our daily tasks. This daily task includes there is a coordination between two eyes, also over a head. So this coordinates the vestibular system. The next, our vestibular system is responsible to make our vision clear by controlling and coordinating between two eyes. Thus, helps to read in the complex environment, in the complex visual feedback like computers, reading a book, newspapers, in the grocery malls, checking out an individual knife. So, the responsibility of the vision is taken over by the vestibular system, as well as the functioning of the body by maintaining its balance over the different surfaces is also responsible factor for the vestibular system. Hence, static and dynamic equilibrium is maintained by the vestibular system. Also, in the dynamic equilibrium, we understand that the person who is suffering from vertigo could not able to differentiate self motion and the external environment motion. Hence, if the patient who is sitting in a car or train could not able to judge whether the train is moving or the our train is moving or the other train is moving. So the differentiation of the self motion and the environmental motion is absent. Let's understand next what are the causes of vertigo. Basically, the vertigo is coming from the different structures as we understood from the different four regions. They are divided into two portions as peripheral vestibular system and the central vestibular system. Depends upon the individual causes. There are several of the peripheral causes as well as the central cause, out of which the peripheral causes inclusive of the vestibular migraine, BPPV, neuritis, and migraine Meniere's disease. The central causes are acoustic neuroma, CP angle tumor, hydrocephalus, demyelination, vestibular-basilar insufficiency, and psychogenic disease, out of which the peripheral causes are more common than that of the central cause. Also, the peripheral causes can have the good prognosis rather than the central causes. Also, I can suggest, according to the evidence based, the migraine, BPPV, and the labyrinthitis with the neuritis are the common causes in the peripheral vestibular system. What are this system is all about? The symptoms of the vertigo has the impact over the patient physically, mentally, and emotionally. According to the causes and according to the origin of the vertigo, there are different symptoms in the vertigo itself. We can understood from this table the physical disabilities and the physical symptoms, the emotional symptoms, and the mental system. Also, due to the vertigo, there is a sleep deprivation too. In the physical component, headache, blurring of vision, nausea, vomiting, dizziness, sensitivity to noise or light, balance problems, and fearing of tiredness is common. In the emotional aspect, irritability, sadness, and the nervousness and anxiety is the most common. The person feels that I am slow down. The person could not able to think clearly and could not able to remember the new information. And vertigo and its frequency and fear of the acute attacks. Let's understand what are the potential risk factors along with the symptoms of vertigo. The symptoms of vertigo specifically is dependent upon the temporal variation. That the symptom is last for seconds. Does the symptom is last for hours to weeks? Does the symptom is constant or does the symptom is episodic? Depends upon the temporal variation, we can differentiate to the origin of the vertigo. There are several precipitating and the trigger factors too. The precipitating and the trigger factors could be the vertigo at rest, vertigo at the spontaneity, vertigo while walking, vertigo while changing and turning the positions quickly of the head, accompanying impairments inclusive of the hearing loss, and several other central impairments like dysarthria, dysphagia, and etc. along with the migraine. Yes, the potential risk factors. History of the headache is common with the vestibular migraine. History of concussion and trauma can lead to increase in chances of vestibular dizziness. History of bone density, vitamin B12 deficiency can land up into the labyrinthitis as well as the neuritis. History of thyroidism, diabetic mellitus, and cholesterolemia alters the metabolic system. History of previous ear infection and disorders like herpes zoster and herpes simplex causes an immediate effect over the neurons and the nerves, inclusive of the vestibular neuritis. Scuba divers are more in the risk factors due to the barotrauma. Females suffer more than that of the males. According, according to which symptoms we can differentiate how this all vertigo can be divided and diagnosed into the peripheral and central. There are several bedside tests as well as the laboratory side test. The patient can be assessed with each component. We can see the patient with the spontaneous and the gaze nystagmus can be found with the acute case, can be also found with the chronic cases as well. Depending upon the origin and clinical presentation, the person can be differentiated and diagnosed. The positional vertigo can be differentiated through the Dix-Hallpike maneuver, vestibular ocular reflexes, ocular scar skits, and head shake test. In the symptoms of the central causes sign, there are several laboratory diagnoses in case of the audiometry, optokinetic nystagmus, Franzen Gobel testing, electronystagmography as well as electropostrography for the central causes. Also, to diagnose the neural pathway, there is a good testing known as evok potential. But as the MRI is the most reliable and completes the task of the evok potentials, the MRI is the more sensitivity towards it. According to the physiotherapy, we can classify the patient and diagnose into the criteria with our outcome measures such as motion sensitivity testing and dizziness handicap inventory. Thus, we can help through pre and post outcome measures. The patients usually ask, if I have got the vertigo, will I recover? Yes, it's absolutely yes. The recovery majorly is possible and it's very good in case of the peripheral causes. With the central cause, there are total 5% of the people who has the central origin lesions of the vertigo. They can also recover, but it depends upon the condition and the diagnosis. Most of the people eventually recover fully with the proper diagnosis and management, out of which there are 20% of chances for recurrence as well. With this, how the vertigo can be treated? Yes, a positive approach towards the neuroplasticity in vertigo helps the patient to recover. The neuroplasticity is a lifelong process. Here, the neuroplasticity occurs with the cortical as well as the cerebellar recovery. The cortical lesions can help into reinnervation, habituation, and adaptation towards the external stimuli. The cerebellar dependent motor learning is a long term process as the central feedback doesn't have the direct pathways and the direct sensory inputs. They are being always relying on the indirect sensory inputs. Thus, the central compensation is taking the longer time and the longer period of time to recover its motor learning. Hence, the vertigo and the neuroplasticity can be treated in such a flow. This can help the person to diagnose at the bedside procedure when there is a central vertigo as well as peripheral vertigo. The patient who is presented with the signs of cerebellar vertigo can be diagnosed as per the central vertigo and can be undergone through the MRI, can differentiate it accordingly. Whereas in case of the peripheral vertigo, the positional testing can be done where the positive approach is suggestive of BPPV, which is benign paroxysmal positional vertigo, as well as the other causes would be Meniere's, labyrinthitis, and neuritis. Hence, how the vestibular system helps in recovery. The role of physiotherapy is very important and crucial in compensation towards the central approach. The central compensation of the vestibular system helps by the vestibular rehabilitation. What is the vestibular rehabilitation is all about? Vestibular rehabilitation is comprising of the gaze fixation, where the eye movements and the eye exercises is done. The eye movement is already predetermined and pre-programmed by our brain. Hence, the first step towards the vestibular rehabilitation is an eye exercise, followed by which we can progress towards the head exercise and the body balancing exercise, where the vestibular system is compensated by the adaptability towards the external situation. If the patient is with the positional vertigo, that is BPPV, canalith repositioning is a crucial, important way of the vestibular rehabilitation to treat the vertigo patient. There are several techniques of canalith repositioning in the anterior semicircular canal, posterior semicircular canal, and lateral semicircular canal. The posterior semicircular canal are their vestibular system affection is the most common. Hence, there is Apley's manure and Simmons manure which is available with us and the patient can be treated. Also, I would like to add one more point is the checkup and the follow-up of such patients can be done so that the patient has been self-trained with this all manures and the patient whenever reapproaches with this symptom can able to attempt the self manure in the acute attacks. Hence, motion sensitivity and the habituation exercises can also help the person in practicing their home. Adaptation and self-training is the next goal while return to work. Hence, the patient is always to be motivated to return to work and return to its normal life to improve his or her quality of life. What are the benefits? What can be done with the help of vestibular rehabilitation? Yes, so first and foremost, improvement in eye-head coordination fixes the visual pathways. It reduces the frequency and attack of vertigo. It enhances the body stability, improves the balancing and walking abilities, reduces the wrist falls, improves the vestibular function, and hence makes the patient independent and improves the quality of life. We'll also see how the HealthQ rehab works. HealthQ rehab has the vertigo rehabilitation program. This program is specifically designed to fulfill the needs of the specialized progressive rehabilitation that can impact the patient's quality of life who is suffering from vertigo or dizziness. Hence, we help the patient to recover its own. There are several of the program objectives, which is comprising of the comprehensive and progressive rehabilitation. We approach towards home-based exercise plan, several coping up strategies while working at home, and also the preventable strategies. This inclusive of the firstly assessment of the vertigo, explaining and counseling their SIDS, continuous supports and solution, and also provides by the demonstration and recording of the steps which as per the exercise prescription. What is the beneficial and advantage of HealthQ rehabilitation program? Yes, so there will be the total of the 4 sessions in the 4 week, and we offer for 3,200 pricing instead of the 4 sessions. How our rehabilitation works. So what the home-based exercises we gave all about. Home-based exercises is beneficial to complete the exercise program between the 2 therapeutic sessions, and it makes the successful rates towards the rehabilitation process. The patient is being given with their frequency and the duration of the therapy as per the vestibular rehab. There will be an eventual advancement of the exercises too. The exercise prescription will be given to the patient to improve their overall health and functioning of the vestibular system. By this, the patients may ask what are the coping strategies to return to work. Yes, the cognitive and the psychobehavioral therapy can help the patients for the coping up strategies. Self-relaxation and calming techniques, desensitization to the precipitating factors, self-oriented and the anxiety and avoidance behavior. This should be explained by the therapist towards the patient, explanatory about the excessiveness of the self-observation, developing of the self-confidence and enhances of the energy conservation techniques. The patient usually asks why my symptoms, if my symptoms can recover, then what can be helpful? Yes, the symptoms can may recover from time to time. These are the major causes when the person is in stress, the person is with the other illness, the person is with the fatigability, the person with the sedentary lifestyle, and if the person have created their own overactivity in the good days may return all the symptoms. Thus, if the symptoms provokes, how can they be prevented? Yes, the symptoms of this can be absolutely prevented. The person who is with the vertigo has undergone vestibular rehabilitation should be always advised for home-based program and other coping up strategies. Also, also the be timely patient must be asked to have their timely medications as per their prescription, to be active with the physical, mental, and social health, to avoid all the risk factors and the triggering points which they create in the vertigo attacks. The person may be asked to be consistent with their own improvisation of the health. The person should believe themselves so that the person has the self-awareness regarding the vertigo attacks. Also, a balanced diet with the low sodium can be very helpful to the patient with such a vertigo. I would like to add more. The magnesium and omega 3 and 6 is a major mineral which is also helping in the patients with the Meniere's disease. Yes, so my takeaway message for this vestibular rehabilitation program is the vertigo comes from the different origins and must be differentially diagnosed. The person may not be only suffering from physical, but mental and emotional aspects can also be accumulated in the therapy. Vestibular rehabilitation is utmost very important and has an evidence-based practice. In the physiotherapy, neuroplasticity is an ongoing role in the recovery and is very crucial to incorporate in the vestibular rehabilitation. Home-based exercise program, coping up strategies and preventive measure aids to reduce the frequency of vertigo attacks. The vertigo patient can live as normal as that of the others. The person can return to work, can play sports, and can attend the social gatherings too. The important takeaways also is to take my references and have the good reference with the vertigo patients. These are my references. I hope my questions and my presentation would be helpful to you, and I hope that every information should be helpful and pass on to the person who is suffering from vertigo and can aware about the vertigo rehabilitation.
Thank you so much, Dr. Krina.
Yeah.
It was really a nice and very informative session. A lot to be learned, and I believe a lot of people are suffering from vertigo, but they are not aware at first place that what exactly is vertigo. So I have one question for you, for
Yes.
on behalf of other people. If a person who is suffering from vertigo as of now has been already diagnosed with vertigo,
Right.
what should be the steps he or she should follow in order to take some preventive measures at home itself, so that they can at least manage or maintain their whatever balance system that is already present.
Right. So first most, when the patient is diagnosed with the vertigo, first most is to take the symptomatic treatment, especially if the patient is with nauseatic, if the patient is with vomiting, anti-nauseatic medications are the first most priority. After the subsiding of such symptoms, the person can be immediately shifted towards the vestibular rehabilitation. Vestibular rehabilitation can help the person to manage their own daily tasks. The firstmost, I would like to advise the person that take such measures to not to fall around. Take the help of the others. Take the help of the other assistive device to walk. Take the help of ball or either the can or the walker can be used so that the risk of falling can be reduced to prevent the other secondary complications. Then the next would be timely make the routine for the diet. As the person is in very anxiety state, the person can be first followed with a good proper balanced diet with the low sodium, especially in the cases of the thyroidism and diabetic mellitus. The second, the patient could start with the gentle neck movements and the eye movements, such as if my hand is in the line of my arm length, I would start with the focus on my eye and then eventually start moving my head from side to side first and then up and down second. Then I would like to advise them to move their fingers and make the head stable and to do the gaze stabilizing exercise like this by moving the fingers right, left, up and down eventually. Then, after the patient who is suffering from vertigo can be started the exercises of the general body exercise like sit to stand and some basic stretches of foot and hand as the patient is with the complete spasm. The next, I would like to advise the person not to panic itself because panicking will itself make the patient more frequency of the vertigo and the duration of the vertigo can also last longer. Third, the steps towards the maintaining the balance and the mobility of eye and head coordination must be the first priority.
All right, very nice. Thank you so much. One more question I've got is how gaze stabilization exercise will help a person.
Yes. So first, the gaze stabilization is helpful. I'll explain by an example of suppose there is a platform and suppose there is a train. Whenever the train comes towards the platform, then only the passenger inside the train can take the advantage of whatever availability or the facilities which of the train's platform is lying. So the gaze stabilization is basically a platform which is our head and the eyes is our train. So whenever the eyes is fixed over your head, the vertigo or where the vision is not proper, the vertigo is coming just because our eye is not getting fixed. Hence, every time whenever you try to coordinate with your eye and head, your vision gets fixed and your chances of recovery during your process of the head and eye coordination improves. Thus, let the train come over the platform so that the coordination is refined.
Perfect, perfect.
Yeah.
All right. Yeah, any other question for other people who have joined is there?